Bill Bird. I am the Chief Medical Officer here at CGH Medical Center, and we're doing week 6 of COVID-19 CGH updates. I feel a little lonely talking to you because Sandy's not here with me, but at least I don't have to worry about my arms flapping around or anything like that, so I don't have any zones where I can move around. Anyhow, glad you joined us, and I think what we wanted to do today is we'll do some of the questions about specific to COVID later on, but the first thing that I wanted to take the time to talk about is mental health. And I'm glad to have someone whose life work is mental health, and that's Christine Romesburg. She's on the line with us. And Christine does our Ways to Wellness program here at the hospital. And I'm going to spend a little time just having a conversation with her. And as you're listening to that conversation, if you have questions that come to mind, please feel free to send those in and we'll try our best to answer them. So Christine, welcome.
Hello.
Okay, I'm hoping folks can hear you well. Hey Christine, just tell us briefly about yourself. What's your background in terms of education and everything?
Yeah, so I have a bachelor's in psychology and sociology. I have a master's in social work and a master's in business and administration. And I'm currently working on my doctorate in public health as of now.
Okay. All right. Do you have enough initials after your name for I think this conversation to move forward? So good. All right. So Christine, tell me a little bit about Ways to Wellness and what you do in Ways to Wellness for our patients and members of the community.
So Ways to Wellness is such an amazing program. It's a partnership between the CGH Foundation and Mississippi, and I'm so grateful the foundation supports it and funds it. I see a wide range of stuff typically in clinic right now. The issues are a little bit different, but free counseling for patients with CGH. I also do a lot of case management and social work stuff. Patients who can't afford their meds, maybe having issues with insurance, obviously working on those mental health issues such as anxiety, depression, and so on. So I stay busy at CGH, and I love what I do. I'm grateful to be there.
Yeah, glad to have you, Christine. So what have you noticed about, what are the things that folks seem to be reaching out to you for right now? What are the mental health or other issues that you take care of are you seeing?
So I've definitely seen a lot of people who have had increased anxiety. Maybe they're fearful over their health or the health of their loved ones, financial issues that they're now fearful of. They're maybe getting a little stir crazy or missing family members. Their sleeping patterns and eating patterns may have changed. They're having difficulties adjusting to their new normal, maybe with the homeschooling and staying at home or working from home. So definitely seeing a lot of that. And then also like insurance issues where they were employed and now they're laid off, and so how's that affecting their insurance? So I've been helping with that. But yeah, definitely I've been seeing a lot of people who have been a little bit more fearful during this, and they've been able to reach out and kind of process those emotions with me, and typically after they process it, they're feeling much better. So that's always good to get those emotions out.
Good. Do you have any, like, if you had a list of things that would be helpful to do to reduce anxiety and fear that the folks that talk with you have, do you have a list of things that you recommend?
Yes, I do. I feel a lot of anxiety right now is coming from the news. So if you need to, turn that TV off, turn the news off, take a break from it, give yourself some time and space to think about other things. Making sure we're taking good care of ourselves, meditation, taking those deep breaths, getting outside, getting some exercise, making sure you're eating those 3 balanced meals a day, and then keeping a routine and a sleep schedule And I know we're at home, a lot of us are at home, but make sure you're still taking time to relax, because now we got our kids at home and our schedules have changed. So making sure you're taking some time for you. I can't stress this enough, but socialization via, FaceTime or phone, just making sure you're reaching out to others and talking. That's such a good outlet for our wellness. And, give yourself a break and just know that we're all in this together, so reach out if you need to.
Yeah, those are great thoughts. I've been reading a book recently, and have you heard anything about? So the one of the premises of the book was that in our brain, our brains have a tendency, because of how they've evolved over time, that it's pretty easy to go negative and to extrapolate negative things rather than positive things, and yet though our brains are able to, if we dwell on positive things more and think about some positive moments that we've had in every day, that if we fire those neurons that are the positive things that have happened, it tends to rewire our brain and gives us a more of a positive outlook on things. Do you have any thoughts on that, Christine?
Absolutely. There's so much research basically on what you're saying, that even gratitude, just being able to identify things you're grateful for each day, is greatly correlated to happiness. They say it can increase your happiness by almost 60% just to be more grateful.
Yeah.
So, with a lot of my patients, they tend to get in those negative thought patterns, which can be very harmful on their mental health. So, looking at the positive things, being mindful, being grateful, definitely helps improve our wellness.
I was at this conference one time, Christine, and they talked about it. They did some study, and they had folks name 3 things every day. I think they did it maybe towards like mealtime or something like that. 3 things that they were thankful for, and they measured what their level of happiness, which is kind of a subjective word, I know, but how happy they felt prior to that, and then 6 months later, and the folks that had done that felt much happier in general than the folks who hadn't done that. So it kind of goes to that whole gratitude thing.
Exactly.
Yeah. So, I'm sorry, Christine, I cut you off. What were you going to say?
No, I was just thinking it was kind of funny because I actually have my patients do that all the time, because I've actually looked at that same study. And typically within a month or so, they're so much more, again, happy, which is subjective, but they're more positive in their daily life. So it's a good, little assignment to give yourself each day. Just write down 3 things you're grateful for.
Yeah, absolutely. I was reading about the human brain as well, and human being. The sentence was that I read in this book that I'm rereading. This one is what it's called, "Stumbling on Happiness," and one of the things, the tagline was that the human being is the only animal that, and this author talks about that a lot of psychologists, that's the question, right? And for us, his premise is that the human being is the only animal that thinks about the future, which is really good, because we can be here and then think forward, which it's a fun thing to be able to do that as you mature as an adult. But that as you plan that and you think about the future, that's where anxiety comes in. And trying to live in the moment can be really hard to do.
Yeah, so anxiety basically just means fear of the unknown, fear of the future. So mindfulness is a great tool to utilize if you have anxiety, and that's just like focusing on the present moment. It can look, especially now, it can be scary with how long is this going to be our new normal, but if you just focus on the right now, it tends to alleviate that anxiety. So mindfulness is always a good tool to utilize in those situations.
Good. So I forgot to mention, Christine, that my understanding is that this service that you're providing between, it's kind of a joint thing with Mississippi and the CGH Health Foundation. My understanding is that's free. Is that correct?
It is free for all patients of CGH. That is correct.
Okay. So the free word's a nice word. So I just want folks to know that.
Yeah, the foundation's been amazing with providing the service for CGH patients, and I've seen it save lives and do so much good in our community. So again, very grateful for the foundation for providing the service.
Yeah, good. So, do we have any questions for Christine's standpoint?
No.
We'll make sure. Okay. So, Christine, anything else that what other questions did you think I was going to ask you that you haven't had yet? I'd like you to answer those for us.
I'm trying to think. Just remember, because I know so many people are just most of my patients, I'm just hearing that they're anxious, or especially the patients of mine that are living by themselves. Just make sure you're reaching out to other people. I know we're staying at home and we're supposed to be staying away from people in person, but that doesn't mean you can't contact them in other ways. It's just reaching out could make us feel so much better and so much more connected during these times. And of course, if anyone feels like they need to reach out for professional help, please reach out to me and we will set up an appointment. My extension at CGH is 1916, so anyone needing some additional help right now, please utilize the service.
Okay, yeah, so if they wanted to reach out to you, the phone number would be 815-625-916. Is that right, Christine?
Correct.
Okay. All right. So yeah, if you have interest, and I'm guessing Christine's on our webpage and that type of stuff too. So there's other ways to get Christine's help. But yeah, that's Christine. I appreciate your time. Appreciate what you're doing to help our patients out, and thanks for being our first guest here on the Facebook Live. So thank you.
So thank you so much, and everyone have a good day.
Yeah, you too. Okay, so yeah, Christine's a great resource, and encourage anyone out there, if either yourself or you talk to your friends or family and they need someone to talk with, I know that Christine would be a great resource for you. All right, so what I'm going to do is transition into just kind of our typical COVID-19 update stuff. So the first thing that I was going to mention was our testing results. So we've done 501 tests here at the hospital as of this morning. 445 of those were negative, and 36 of those were positive. In the county, this morning I looked, and I think there are 45 positive. So that goes to the fact that some of the people who live in the county have been tested other places, and obviously that counts towards our number. We have had 2 deaths here at the hospital. Last one has been several weeks ago, and the county death total is 3. And once again, that kind of speaks to that if someone lives in our county but passes away in a different place, that still counts towards our county's numbers. We continue every day to have patients who are here in the hospital who are persons under investigation and or positive patients for COVID. That continues to just kind of keep happening. I don't know that I can say that we've seen a significant movement downward at all. A matter of fact, when when Sandy and I talked with you last week, it seems like we were at like 23 cases. So we definitely have had more cases in the past week than we've had recently. So here's my question list, and I'm just going to start going at those. Thanks. Oh, okay. Yeah. So my spotters have told me now that we have the county now has 50. I shouldn't be smiling about this. The positives. The county now has 53 positives and 4 deaths. Okay. So the first question is similar to what I just answered, but let me just say it again, or ask it again. If a person is from Illinois but passes away in Iowa is that considered an Iowa death or an Illinois death in the totals? And that would be an Illinois, would be considered an Illinois death. The next question is, do I wear plastic gloves and mask to grocery store? I don't think I would do the plastic glove thing. I think before I went into and went out of the store, I'd make sure I disinfected my hands. As far as the mask, yeah, I would wear a mask when I was in a grocery store so that you're protecting yourself and others. So those cloth masks, that would be something that I would recommend. Is it possible to contact the virus more than once? I don't think so. But don't hold me to that. We're still getting some more information about that as time goes by. We're leaning towards the idea that you develop immunity once you've had the infection. Is it okay to pet another person's dog? Well, I'm afraid of dogs, so I think the answer would be no. I was attacked by a pack of poodles when I was young, but I won't go into details about that at this time. Anyhow, yeah, I guess I would say that all kidding aside, I'm not a big fan of petting someone else's dog because of you have someone else that they're potentially infected touching their animal, then you're touching their animal. Wouldn't be real high on my list of things that I'd want to do. Next question is, how about the zinc and tonic water being said to help? I don't know at the moment that I would endorse. I know at the moment I would not endorse that. I'm not aware of any science that backs that up as being something that's helpful. Okay, the next question is, with the uptick in confirmed cases, are you finding during contact tracing any commonalities, aka hotspots? That's probably something I'm going to leave it to the health department on that. I would say in general, when you have, like I know over in, is it Ogle County where they had the Hormel plant that they ended up shutting down? At least in that situation, definitely was some commonality, and you had folks that were working closely together, and at times also traveling to the place of employment together and or living together or in close proximity to other folks, and that's a recipe for increased numbers of cases. Do you have any recommendations on whether or not large summer events should take place or when groups should make decisions? No, I'm not going to be the one making those recommendations. I would say right now, I am following, and I think other folks would recommend that you follow what the governor is recommending. I'm hearing that today there was going to be an announcement made, and I think he was going to extend that shelter in place longer. I'm not sure if it was. Do you know, Dana, how long it was for? No.
I haven't heard yet.
Yeah, I'm hearing though that's going to be some extension of that, whether that's to the middle of this month or the end of this, the middle of May or end of May. I'm not sure.
He's on at 2:30.
Okay, so yeah, I'm hearing he's on at 2:30, but the word on the street that I heard was that there's going to be an announcement about that today. And that's what I would go on in terms of summer events and those kind of things. So I hope that around June 1st that we can have things more running like normal. But I don't know if that's going to mean normal other than we can't go to the Garth. We're not going to have a Garth Brooks concert, or we're not going to have the Mississippi Valley Fair and all those. I don't know. I just don't know. Okay, what is the recommendation for bringing groceries into the home? Does each item need to be disinfected? Yeah, I would say that I think that you're okay to just disinfect your hands and wear the mask when you go in the store, and then when you leave the store, disinfect your hands when you leave. And other than what you typically would do for your fruits and vegetables and those type of things, I don't know that I would recommend that you need to disinfect anything else. So that's just how I would see it right now. Okay. these questions go quicker when it's just me rattling these off. I think Dana has another question here. You know, one thing I did want to mention is that we have started to ask all of the folks who come into CGH, whether that be our clinics or the hospital, that we're requiring them to wear a mask when they enter. And so I'm just making that known. We have it on our website and Facebook pages as well. But so if you're coming to the hospital, if you have a cloth mask or a mask that you're wearing out in public, we would ask that you bring that here and wear that when you come into our hospital or office or the clinics. If you don't have one, we'll provide one for you, but obviously we prefer not to use our own PPE supply for that. I will also mention that on our Facebook and website, there's information about how, if you're someone who is able to make a mask, how to go about doing that. And we also are asking for those folks who are people that can make those things, if you're able to make some and donate some of those that we could use and hand out to patients, that would be much appreciated as well. And once again, on our website or Facebook page, there's information about how we're going about what specifications we're asking for in those masks and how to donate those. So yeah, I just want to get that information out there and everyone be aware of that. There was a question about ReadyCare, and is ReadyCare still open? Yes, it is, very much so. So ReadyCare is open. Basically, we still are using either ReadyCare or our emergency department where we're doing our testing. So yeah, that's kind of the, I'm gonna write this down before I get it. So yeah, if you have respiratory symptoms or some other just acute medical problem that you think you might need addressed, obviously we encourage you to start with your primary care physician's office, and then they'll direct you whether they can see you or whether you need to go to ReadyCare or the emergency department. So yeah, that's still open and still seeing patients. The next question is, when will doctors be back in offices? So we are going to start as I sit here and speak right now, it seems like things change every day, but as I sit here and speak right now, we're planning on a slow rollout on May 1st. So we'll have a small number of patients that offices will start to see, and we'll do that for some period of time. We're getting things structured so that we can make sure that when our patients come into our offices, that the patients as well as our staff are safe. But I think we're working that out so that May 1st we'll begin that. Even that as of May 1st, we will continue doing telehealth visits. So for our patients, for the vast majority of our providers, not all, but the vast majority, you would either have an option of a telehealth visit, or our physicians and nurse practitioners and physician's assistants may ask that you come to the office if you have an issue that they need to actually do an examination or feel to be appropriate. So yeah, we're getting that all figured out so that we can begin doing that. And the question is, it safe to be at CGH or clinics? Yes, I feel like that we're having folks, both staff and patients, wear masks. In any situation here in the hospital, we know if someone is having a test or whatnot, we have a very regimented way that our staff are addressing that. We have social distancing set up in our waiting rooms. We are doing all the sterilization and disinfection that you need to do for patients. I think you're probably, we say this, and I think it's probably accurate. You're probably safer to come and be in the hospital than you are to go to a grocery store. Not that it's unsafe to go to a grocery store if you're wearing your mask and everything. But yeah, I think at CGH you would be safe if you needed to come here for medical care. We aren't encouraging that we want to have everyone that needs something done to come in. That's why we're going to have a slow rollout of our clinics and eventually a slow rollout of our operating rooms and procedures as well. Thanks, Dana. Let's see here. Is the Tyson Joslin plant getting it more than anyone else in the area. I know there are some in Prophetstown. You know, I've heard that plant has had some cases. I don't know the details of that. First of all, that's a health department more of an issue than it is an individual hospital issue. And also that's in Rock Island County, so that Rock Island County Health Department would probably be speaking to that more than even our health department would. If you have more questions about any particular plant, I think I would look at the website of the Illinois Department of Public Health and or that particular county's health department website and see if they have any information about that. I have been doing some reading about that, and it does seem that just in general across the country, these factories where a lot of folks have to work really close together to get the work done are the ones where they seem to be more problematic. And so there are, I don't know how many, but there definitely are some of our meat packing plants that have struggled due to just the folks and how they're having to work there in those plants. Okay, how many homemade masks do you need? I don't have a number. I'll tell you what, if we get too many of them and we say, you know, we don't know where to pile all these, I'll let you know. But until then, if you have them, we really would appreciate if you would bring those in. Okay, is vitamin C helpful? Any other vitamin suggestions? So, I can't say that vitamin C, I mean, there's nothing wrong with vitamin C, and the nice thing about vitamin C is you can't overdose on it because it's water soluble, so you just urinate it out if you have too much vitamin C. That being said, some vitamins that are lipid soluble, you can take too many of. So, and this is just more my philosophy, is I'm convinced that if, by and large, if we eat healthy, so if you're eating fruits and vegetables and basically all the outside of the shopping of the store where you have your fruits and vegetables, preferably more of your white meat and fish, a little bit of red meat, but more the other, and you kind of stick to that kind of stuff, you're going to get plenty of vitamins, plenty of minerals, and your likelihood of staying healthy is really good, irregardless of how many supplements you take. The last study I saw on supplements didn't seem like it made a huge difference in terms of how people do, in terms of what vitamins they take. So yeah, that would be my I know it's more boring to say just eat healthy and also exercise and do those kind of things, but I think it's true. Matter of fact, I wouldn't say it if I didn't think it was true. Is it true the virus originated here? Okay, so I don't know the bat, whether it originated from a bat or not. To be honest with you, I read about that early on, but and I think most of us here in hospitals are just focused on trying to do everything we can to make sure we have everything in place we're right here in the hospital with what we can control. So I don't have an answer for you about bat or no bat in terms of the origination of this virus. And the follow-up to that is, should we worry about the bat population here? No, I don't think so. I don't think that first of all, if it originated in bats in let's say another country like China, I don't think that I'm not an expert on bat migration, but I don't think there's going to be necessarily a correlation with any sort of infection or an infestation in somewhere on the other side of the world in terms of bats. The only thing on the bat side I would say here is that we still have issues with if you have a bat in your home and you find them, then you'd want to let the health department know about that, because they have certain protocols they follow, in particular more about rabies and that kind of stuff, but not so much about this particular virus. Well, thanks, Dana. Next questions. Do you recommend the use of a pulse oximeter to monitor lung function, and what is the normal range? So my inclination is, I don't know if you otherwise feel like you're breathing okay that you need to do a pulse oximeter. I know that in certain populations they've used that. I'm not right now hearing that that as a routine thing that people are using to try to get some sense of people and whether they have COVID or not. Now, as far as the normal range, most of us are in that 98-99% range. So that's kind of where most of us trend. Some people that have respiratory issues like COPD, they'll run in the upper 80s, low 90s, and to them that's just kind of, they feel okay there. Now, if your lungs are normal and you go from 98% to 90%, you'll feel poorly. But if you get kind of over time, get acclimated to that number, then you can do reasonably well. Thoughts on the second wave coming in the fall. So yeah, this is something that people smarter than me are trying to figure out. I've heard that, I've read that, I can see that to a certain extent, but I don't know if we know for sure. The one thing that I'm hopeful, if there is a second wave that comes in the fall or winter, is that in the interim, that would hopefully give us time to stock up on our testing supplies, stock up on our PPE, which, has probably been the two biggest, gosh, I wish we had those things since this all started. So if we can get to where we have good supplies of those, if this were to occur again, that would make a big difference in terms of how we go about handling this and how things would go in terms of recommendations that would be coming from the government and healthcare providers. The other thing that is people are working really hard on trying to come up with a vaccination, and they're working really hard on different treatments, medications to help folks who get sick with this. So, I don't know, fall's pretty quick, even winter's pretty quick, but man, folks are working really hard to see if they can come up with something that will help people if they get sick with this. Even within our area, across the country, I think I mentioned this last week or the week before last, some work is being done with plasma and so basically people that have the infection and have recovered, having them donate their blood to blood banks, and then they spin it down and then use the plasma to inject in the patients who are really sick to try to help them out. And I know some research is being done across the country with that as well. So we'll have a lot more people who have recovered from that by this time in the winter or fall. And if that happens to be a treatment that seems to be working, we should have a decent supply of that as well. I know that even our regional blood bank is, I think they've already accepted a few folks who have recovered and tested positive. You have to be recovered for over 28 days, so it's a little bit of a long thing to get it all in place. But that's an option that hopefully will work out as well. We'll see. Time will tell on that. Where should we bring masks? So there's a website that kind of gives some more information. It's called Donate Materials. That's one word. Donate Materials at cghmc.com. cghmc.com. And Dana's going like this. What's that?
It's an email. That's an email address.
What did I say?
A website.
That's an email address, okay? Or drop off, if you could, our front line, like the main clinic, front entrance, or the hospital's main entrance would be options as well. Yeah, and those are kind of, I think I'd start with the email site, go to the email, but we'll work something out with if you're actually having those. But the main lobby at the clinic or the hospital would be other options to drop those off. And once again, thank you for those of you who are willing to take that banner up and start making some of those. If it is spread by droplets, why does everyone have to wear a mask? Okay, so I'm going to answer that question first. So, yes, it's spread by droplets, but like when I'm speaking towards you right now, there are droplets that are coming out of my mouth. I'm not too big of a spitter, but there's almost every time we communicate, there's a little something that comes out of our mouths. Those are the droplets that, like, if if the person was like this close to me, like that close, that some of those could land in around their face, and then they got into their mucous membranes, could cause some problems. So it's not like I talk and then that goes in the air and just hangs out in the air for some period of time. That's called aerosolized. And this is not that. But a mask, at least, what it does is when I'm speaking, that as I'm speaking, those droplets don't go out as easily. It has to get past that cloth, and that helps. And if both I'm wearing a cloth mask, and let's say your healthcare provider is wearing some type of surgical mask or other mask, that really cuts down the chances of those droplets getting from you to that healthcare provider, or vice versa. And then there's it's kind of a comment, not a question, but I'm going to make it into a question. There is so much talk about people with no symptoms. So I think the comment is like, so what's the deal with that? And the deal with that is, yeah, that's a deal, but I'm not sure what the deal is yet. Like I was just reading the other day, and in LA, I think it was LA, they did a sampling of folks to see, I think if they had antibodies, and they found like, I think they said between, I'm just going to throw out the number, I think it's like between 3 and 4% of the people that they tested had evidence of antibodies to COVID-19, versus the percent of the population who actually had symptoms was much lower than that. So I think we're going to, as we begin to have access to both the tests that just say whether you're positive or negative for COVID, and eventually the test that tells the antibody tests that tell you whether you're positive or negative for the antibodies, I think then we'll get some sense about what actually is the prevalence of this virus in the community, in terms of what percentage of patients had asymptomatic infections. Much like the West Nile virus, the thought is that there's a good chunk of folks who've had West Nile, that's the get from mosquitoes, that a lot of people have had exposure and they just didn't get sick from it. But we'll find that out over time, and that also is part of this second wave thing that we'll see. But if we could get the testing up to speed, it may give us more information if there is a second wave, to better understand, who has it, who doesn't have it, how we need to go about thinking about interacting and taking care of folks in light of that. Dan? Thank you. Okay, why do I have to wait until I'm deathly ill to be tested? It's the same old answer that I hate to say again, that I've said the other times that we've gotten together for this talk, is that we still don't have the number of tests that we need to right now test our sickest patients are going to be hospitalized, and we have enough to test people who are being hospitalized, and we definitely need to test them because we don't want to use PPE any longer than we have to if they're negative. And we also want, of course, for healthcare workers, people that work in institutional settings, we definitely need to be able to test them. We have expanded it ever so slightly, and that now if someone shows up to Ready Care or the ED and they work in some big one of those food processing kind of places, we will test them typically, and so we're trying to do some stuff like that. But we check our numbers on amount of test supplies and everything that we have every day, and we're still not there yet. I'm hopeful. I keep saying I'm hopeful. I am, that at some point in time, the amount of supplies that are needed and will match the number of people that we need to be doing the tests on. I think I saw a number that ideally, it was 5 million tests were needed to do a week maybe? I forget what it was, but it was a crazy number of tests that we really would need to test all the people we would like to test, because if we could test everybody, even if you just have mild symptoms, or if you have mild symptoms, we could test you, you're positive, and then we would say, okay, who have you been around? And then, I've been around these people. Okay, let's test all those folks. We would love to do that. We just don't have the testing to make that happen yet. Okay, let's see here. Oh, I'm sorry, the follow-up to that is I'm an essential worker who comes into contact with lots of people. Yeah, so if you're an essential, I don't know how you're defining essential, but if you're a healthcare worker, someone works in a prison, someone works in a nursing home, someone works in one of those like big meat packing factories or something like that, we're going to be testing you. Would a pneumonia shot help prevent COVID-19? Unfortunately, no, it would not. So the pneumonia shots that we have, I strongly encourage everyone to get, because they can. It's, my gosh, it's just a good example of how important vaccines are. Because if you have a good vaccine, you can prevent a lot of stuff and not have to deal with those infections. And I'm going on a little bit of a tangent, but I will say that, like, when I was in medical school and residency, which wasn't that long ago, as you can see from looking at me, that at that point in time, they came out with some new immunizations for like Haemophilus influenza and pneumococcal pneumonia and those kind of things, particularly for kids. And it's in my career, it's been interesting that the number of, like, from medical school and residency, the number of kids that would have ear infections and sinus infections and pneumonia and meningitis was a lot higher than it is now, and that's because now we vaccinate kids for those things and they don't get those infections like they used to get. Our pediatric floors are not nearly as busy in the hospital as they used to be, and I think a lot of that is because of the immunizations that we have. So yeah, shout out to immunizations. Can't wait to get an immunization for COVID-19, because it's going to be able to do the same type of thing. It's going to keep tons of people out of hospitals and from getting really sick. But anyhow, pneumonia shot is for a bacterial infection, and COVID is a viral infection. I've heard a lot about heart blood clots in this disease. Are you putting folks on blood thinners when admitted? Yeah, I can't speak to a lot. I don't think that we're just putting patients on like therapeutic doses of blood thinners when they're admitted for COVID or suspected COVID right now. I'd have to check on that, but I'm pretty sure we're not. But what we almost always do on all of our patients is when they're admitted to the hospital, if they're going to be bedridden, we put them on a low dose of a blood thinner called Lovenox. It's like a subcutaneous injection. And the folks that have COVID that are admitted to the hospital, I'm nearly certain they're having that. But yeah, there does seem to be, this virus does seem to have an influence on our blood and make it thicker and more prone to clotting, which can be a problem with blood clots. And then, and then the heart side of things, I'm hearing that, particularly if you get further along in this disease, it can cause your heart muscle to not pump as well if you get really, really sick with it. Let's see here. I use a CPAP and have a So Clean machine. Can I use that to clean a face mask? And it says no, just wash it in machine. Oh, that's you. Okay. I have So Clean machine. Can I use that to clean a face mask? Yeah, I don't know that I would. I have to admit, I've seen the infomercial, but I really haven't delved in a whole lot of detail about the So Clean machine. But yeah, I think you'd be I know this virus is very sensitive to soap. It has some type of, it's an RNA strand with like some fat around it. And fat tends to really break down the soap. So you're going to be in pretty good shape. As a matter of fact, really good shape if you can put a face mask in the laundry and just put it on, if you can put it on hot, that'd be good too. But yeah, I think a laundry would be fine. You wouldn't need to use your So Clean machine. Are pregnant women considered high risk for COVID? Well, what I've been reading lately is it doesn't appear that pregnant women are at risk, any more risk than anyone else for the complications of COVID, from getting really sick or any of those kind of things. that being said, here at CGH, we don't have pregnant folks working right now. I think that was something we started with at the beginning, and we have the staffing to allow us, our pregnant women and some folks who have really bad asthma to stay at home. But what I'm reading is more and more, it doesn't appear that there are big concerns as far as pregnancy goes, and believe it or not, even in terms of asthmatics, that asthmatics don't seem to do worse when they get COVID. It seems like the folks that are struggling with COVID, I'm just reading this today, not all, but almost all of them have some type of chronic health condition in addition to getting the infection. And I think hypertension was a big one, obesity, if I remember right, it was some diabetes, and all those kind of things that tend to cause more problems than pregnancy and asthma. Do you think the virus was here in the Midwest before mid-January? So I would, okay, yeah, you want my opinion, I'm going to give it to you. I think that if you were like in the Chicago area, and particularly people that were doing international travel, that there may have been some folks in mid-January who had been exposed to COVID as they had traveled to different parts of the world. So yeah, I guess in a sense that would be my opinion. My opinion is also, though, in mid-January, like 99% of the people that had flu-like symptoms had influenza A or B, because we had a lot of that lasted from December through the beginning of this COVID situation. We still had a decent amount of influenza in the area. So I think the vast majority of folks who run into me and will say, hey, I had fever and I had body aches and I felt really poorly like a couple months ago. I bet you I had COVID. I think to myself most of the time, no, I think you probably had influenza and you recovered from it, and I wouldn't count on that you had COVID. Long answer to a short question. Where I work sent a memo that they provide hand sanitizer, but be aware sanitizer is not effective after 5 consecutive uses. Is this true? Is soap and water better? Gosh, I don't know that. That is new news to me. So here in the hospital, we use, between patients hand sanitizer all the time. Dana, can we just, next week when I come on, I'll try to answer that question. And if this is someone who is a healthcare worker or something like that, you can reach out. Is it okay if they reach out to you, Dana?
Sure.
And Dana can connect you to one of our infection prevention nurses that can maybe have a conversation with you and maybe better answer that question for you. And is soap and water better? I don't know. I think both are reasonable to do, and both are effective. The thing with soap and water that it's just something just to keep in mind is 20 seconds is a long time in terms of washing your hands. I've been noticing that about myself during this situation here. So the only thing I would say about soap and water is to make sure that you get the time in to actually do the amount of time you need to do for soap and water to be effective. Okay. Coats hang next to each other. Will this spread the virus? There was the New York Times. I have no stock in that company that I'm aware of. The New York Times does this thing where they put out a COVID update in terms of numbers across the country, and it's a free thing. And there was also some articles associated with that, and one of those was about how long does COVID last on like plastic and cloth and all that kind of stuff. Now, if you could reach out to that New York Times site, I think you might find that. If I remember right, clothing was not something that was a real high risk. It's more your plastic and your metal and that kind of stuff, and not so much clothing that you wear. So I would tend to say coats hanging next to each other, probably not unless you're getting a really significant amount of virus that's getting onto that coat. And even then, if the coat's just hanging there for some period of time, I think it should be okay. If the governor extends stay-at-home order, how will that affect medical appointments? I think we're still planning on doing a slow kind of rollout of doing some office visits. It's been now since mid-March when we've actually done anything except the sickest of the sick showing up to our offices by and large, or some real essential services. And so we really feel like it's kind of getting that time where, like, if you have diabetes, or you have heart disease or heart failure, that there are going to be certain situations where your physician is going to say, I think it's really important. When I weigh the pros and cons for this patient, I think it's still important for them to come in for me to take a look at them. So I think that it's not going to change the idea of us still doing some appointments and doing a small number of appointments for patients who typically have come to our offices starting in May. I think it may affect how quickly we ramp that up, because we'll want to make sure that we're able to keep everyone safe when they come into our offices. So it may have more effect on the ramp up than the actual starting the process. If there are plenty of ventilators, why are people still dying? So the reality of a ventilator is, and I just read this today, it was pretty sobering, that for people who are on ventilators, 85% of the folks who were on a ventilator ended up passing away. So, and particularly if you're over the age of 65, if you're on a ventilator, the odds of you getting on the ventilator and then living are pretty small. I think when folks are younger on a ventilator, it's still not that great of an odds, but it's better. So ventilators it's not like a one-for-one correlation with on a ventilator, we can save this person, unfortunately. So yeah, I wish that were the case, that it was just a ventilator-dependent thing. So people are dying because even on ventilators, they get this syndrome where their body kind of fights against itself and secretes these cytokines, and they have a hard time with oxygen exchange in their lungs. And also they get other complications from this virus, like heart-related things, the blood clots that was asked by another person here. And so all those kind of things add up to cause folks to pass away. Let's see here. So is there info on CGH treating patients with any kind of medicine? So actually, it's right now, earlier on we were talking about chloroquine or Plaquenil as being a possible agent that seemed to show promise, and actually that's really trending down quite a bit right now in terms of that being helpful. So we have plenty of Plaquenil, but the research right now is not as encouraging. So right now what we're trying to do is supportive care for most patients. That's kind of the route we're going. We're open to other treatments, and we're always exploring what other treatments are out there. Like I mentioned, the plasma, we're exploring that for our patients. So, and we have a clinical team of our medical staff that meet on that every week or so and kind of updating themselves on what's the latest and what we can do to help our patients out. So we're always looking at that. And then the question, is it true that ventilators are not always enough? And as I mentioned earlier, that is correct, unfortunately. Pneumonia vaccine for everyone or certain ages? Yeah, so pneumonia vaccine is for the young, and then up until the age of 65, there's an adult one that's more for folks who have chronic medical problems like diabetes or kidney disease or those type of things. We recommend that you get those before you're 65, and then everyone over the age of 65 should have the pneumonia vaccine. Okay. Well, okay, so I'm going to do one more question because we're about out of time. And then I'm going to add a couple other things. So what percentage of false negatives for COVID is acceptable? Yeah, that's a good question. I know, okay, so that Abbott lab test, I just saw some information on that, the one that you've heard about, the governor's kind of talked about. That's a company that's in Chicago area, and the Cleveland Clinic did a study on those machines, and I think 12.8% of the tests that were thought to be negative were actually not negative, so they were false negatives. So I don't think that's real great. I would like, I'm not a statistician, as you all know who've been watching these podcasts, but not podcasts, but these Facebook things. Acceptable to me is somewhere in the 90s. You're never going to get 100% with a test, but as close to 100 as you can is better. So what we're doing here is, we know no test is perfect, just like the flu test is not perfect, just for the regular flu. So if we have someone we have a high index of suspicion for, and they test negative, we're telling our medical staff that it's okay to try, just run one more test before we clear that person, because it gives us a better chance of catching someone who was negative on the first test, but then the second test comes back positive. Okay, so hey, I see that everyone said thank you. Well, thank you, everyone. I appreciate you all listening in and watching this and sharing this with other folks so they can get some of this information. Once again, want to thank Christine for being on our program and talking about mental health, and check that out on our Facebook page and website. As always, I want to take a moment to thank the folks at CGH. All our staff are doing a great job of taking care of our patients, of taking care of each other. We're doing all the right stuff to keep everybody safe and to try to take really good care of our patients. So, and thanks to Liz and Dana for you guys putting this together. It's good to do this. I thank you for those who have listened, for your questions. Really good questions this week. And look forward to chatting with you again next Thursday. And once again, if you have questions that you beyond this that I maybe touched on, but you need a little more explanation, you can go to info@cghmc.com for other comments or questions. So until next week, thank you and goodbye.